one of the important elements of Missouri's response to COVID-19 and specifically the vaccine distribution is to make sure that anybody who wants a vaccine can have access to that vaccine. And so being week 4 on the job, I was thrust into co-chairing the Missouri Advisory Committee on the Equitable COVID-19 Vaccine Distribution with Mr. Adam Crumbliss, who is part of the leadership team from DHSS, the Department of Health and Senior Services, to make sure that we are distributing the vaccine across the state of Missouri and obviously serving underrepresented, underserved, vulnerable populations. And Adam thought with my background in the disability space that I would be the perfect person to chair this. We actually meet every Thursday. And so I would encourage you, these meetings are available to the public. And Molly, if you're not getting those emails, I will be happy to share them with you. These meetings are every Thursday at 1 o'clock. The committee is very diverse and we're always looking to expand that diversity. And so if you want to be part of those, Molly, from SAGE's perspective or share them with your membership, that would be absolutely amazing. The purpose of this committee is simply to make sure that our external partners to the Department of Health and Senior Services are helping us inform that equitable distribution of the vaccine and the vaccine that we get from the federal government down to the state of Missouri. And then what we're doing is to make sure that we have equitable distribution across our regional implementation centers. So I spent some time in DC, so I know that things can get very acronym soup-y, if you will. And so if there's any time in this presentation you have questions about what a regional implementation center is or a specific acronym, I'm happy to answer that. Really, the benefits of being part of this group is to make sure that we're increasing access and leaning on our community leaders to help us strategize how we deliver that vaccine to the people that need the most. A lot of what I'm doing in my role are presentations like this to groups to make sure that we're answering their questions and helping really inform the ideas and strategies that you have at a local level or in your communities to our statewide response. Obviously, having organizations at the table to help make sure that your membership is represented is key to our success. Leading a national disability rights organization, I participated in a lot of these committees, both at the federal, state, and local level. And so the more representation we have, the better. I know a lot of organizations are putting out policy statements and position statements on the COVID-19 response and vaccine response. So anything you all have in terms of recommendations, we can get those to the committee to help us put more voices at the table so we're heard. And then finally, just to increase awareness, people have a lot of questions. There's a lot of myths out there, and we want to make sure that we're responding to those. On tomorrow's advisory committee call, I'll just give you a short preview. We actually have the head of the communications department for the Department of Health and Senior Services presenting on our communication outreach and efforts. Today, Governor Parsons just announced our COVID-19 vaccine dashboard. And Molly, I'm going to put that in the chat as soon as I kind of click through these slides. We're really excited about this because part of the work that we're doing across the department is to ensure that we have the greatest level of transparency to patients and to individuals across the state of Missouri. And so you will see in real time the amount of vaccine supply we have, how that's going into arms, where that's going across the state. And we're really excited about that because it's another layer of complexity in the vaccine distribution response, but we're ensuring that we have the greatest amount of transparency for people throughout the state of Missouri. So I will certainly also, Molly, push out and promote that information about our equity committee because we would love your participation. And the other great thing about this committee is we have representation from the NAACP, the family physicians, the nurses, a lot of the healthcare workers that are on the front lines that are helping us ensure that this vaccine is equitably distributed. Just a couple quick updates. You have probably heard and seen on the news, phase 1A, phase 1B, where is the state of Missouri in our rollout? And that can be very complex and very detail oriented. So I thought what I would do is go through kind of where we are in our prioritization of the vaccine across the state of Missouri. We are currently accepting patients or individuals that want the vaccine in the phase 1A and the phase 1B category. And a lot of people want to know what that means. And so vaccinators should begin, and we started this process as soon as the supply became available to the state of Missouri right around the holiday season. Vaccinators should begin to provide those doses to employees in that phase 1A group. And so through our equity committee, we are providing a breakdown of those phase 1A, those patient-facing healthcare workers. You've probably seen on the news, we have to vaccinate those healthcare workers that are on the front lines. Just from my personal experience last week, being in the ICU with my best friend with Down syndrome, all of those nurses that were taking care of her in a very critical care perspective had obviously all received the vaccine. And so it's been important to prioritize those individuals on the front lines throughout this process. Those categories really fall under, in the phase 1A, we're still on phase 1A, hospitals, long-term care facilities, and residents, including those individuals in the Department of Mental Health, those that operate the Department of Mental Health operating facilities. The licensed entities fall under these categories you see on the screen. Hospitals, obviously the personnel that are working across those hospitals, the skilled nursing facilities, and this includes the personnel and the residents in those skilled nursing facilities. The intermediate care facilities, again, personnel and residents. Assisted living, obviously, fall under a very high risk category as it relates to COVID-19. Residential care facilities, and of course, our state veterans homes across the state of Missouri. So this all falls under kind of those phase 1A expanded definitions. You're going to hear a lot about those frontline healthcare workers, but obviously that umbrella covers a lot of different facilities across the state of Missouri. Kind of just again expanded definitions into home health, hospice, dialysis centers, and urgent care. And you can see the listings here of what specifically those fall under. Home health providers, so those individuals that are going into a home and providing care. We're talking a lot about this internally within our department response. We have a lot of folks that are homebound, whether they have a disability or another co-occurring condition. And so we want to make sure that those individuals that are providing those services in home are taken care of. Hospice providers, obviously the personnel that are staffing hospice provider organizations and facilities are extremely important. Those individuals that are in our dialysis centers and taking care of patients that tend to be more high risk, surgery centers, and urgent care clinics. I'm going to kind of keep moving along here. Again, more phase 1A expanded definitions, vaccinator staff and those administering the obviously the COVID-19 vaccine, we want those individuals vaccinated as well. We have about 9 vaccine efforts happening across the state of Missouri over the course of this weekend. Molly, I'll also get you that information in terms of where those 9 sites or 9 locations are happening across the state, or we'll put it in the chat box here in a few minutes. So individuals know that as the supply reaches the state of Missouri, it's being distributed across the different regions so that way we can have 9 vaccine sites occurring this weekend. We're working very closely with the National Guard to help provide additional personnel and additional on-site hands to make sure that those vaccine efforts and sites are successful, and we're getting as many vaccines into arms as possible. So again, just a little bit more about the Department of Mental Health support with and falling under that phase 1A expanded definition. You can also see we have a number of personnel and residents in those DMH, Department of Mental Health facilities. I actually presented to our internal team late last week about some of the efforts that we're doing to simplify the information related to the COVID vaccine to our mental health agencies, as well as people with disabilities. People have a number of questions. We want to put this in as plain terms as possible so folks understand the information at hand. You'll hear probably a lot about supporting the personnel and residents that are in day programs. Again, not to continue to bring it back to my personal situation, but my best friend with Down syndrome was in a residential facility and a day program in the Kansas City area. Adult daycares, and then, of course, those care facilities that serve people with intellectual and developmental disabilities. The other thing that really came out of the discussions we had in December and into January with the Equity Committee, this is why this body, this advisory body is so important, and we would love more individuals and more organizations represented, is that we needed to ensure and prioritize EMS, EMTs, and paramedics, those first responders. And so we actually lifted the first responders, EMTs, and EMSs from a lower level priority category into phase 1A. And that was a direct recommendation from the work that we do on Thursdays and throughout the week. So just to put a plug in for the work that we're doing, and the more voices at the table, the more impact and more change we can have as a team. You can see also just more information on the personnel that are supported under that phase 1A expanded definition: your physician, your healthcare clinics, your higher education healthcare clinics, and those folks that are receiving HCBS services, or those providers, the home and community-based service providers in home, those consumer-directed services, private duty home care, private duty nursing care, and the adult foster care system. So this covers a lot of individuals and a lot of personnel. Again, you can kind of read up here on the screen. Molly, I'll be happy to share this with you if you want to circulate it to anybody that wasn't able to join us today. This is really a great slide. I'm clicking too fast to show how the vaccine comes to you. A lot of conversations that we're having is to ensure that employers are helping us vaccinate. If you are required as part of your job to go into the office and you cannot work remotely, we are working with employers across the state, a lot of those large scale employers and some of the metro areas, to make sure that they're our partner and administering the vaccine to anybody that wants one. So there's employer initiated, we have employer or a third party vaccinator, we have vaccinator schedules and vaccinations with employees, and you can kind of see the process and the trajectory on how that can happen. I mentioned our regional implementation teams. We have the state broken out in those different regional implementation teams. And that is one way also to access the vaccine. I mentioned the 9 sites that are happening across the weekend. We're working with our regional implementation teams and the National Guard to make sure that those are a success. And again, that the vaccine is equitably distributed across the state. You can see based on the area, and I know we have representation on today's call from the great state of Missouri, all across the great state of Missouri. And you can see where those regional implementation teams, or our ITs, are falling within those different categories. And if you had any questions on where you fall based on your city and your county, happy to provide that additional information. But this is really how we're working and uniquely working across the state. Jonathan, who was our speaker on the last Equity Advisory Committee, is probably one of the most hardworking individuals across our DHSS team, because we're constantly having communication with our local and our county health departments, as our partnership continues to expand, to ensure that we're getting shots in arms across the different counties across Missouri. You can see a little bit about this is our map that is also on our Missouri Stops COVID.com or .org website. And again, this is probably, I have a resource list, Molly, at the end of my presentation that will provide everyone with that link. We have a qualified vaccinator program. So we have basically healthcare facilities, hospitals, local physicians' offices, pharmacies. We've been doing a lot of work with CVS, Walgreens, and Rite Aid to ensure that they're part of our vaccinator plan, to localize that healthcare. And so we have a map of those vaccine sites available on our website. And as more and more supply becomes available, you will be able to access that map to find out a location that has the availability for the vaccine near you. And so this is going to be an important tool. And we've built this as quickly as possible to ensure that access is widely distributed across the state. And again, this will be, Molly, in the follow-up materials that we get to everyone, so that way you can click on that map and find the location nearest you. Last week, to transition into that phase 1B category, as we start to open up more and more categories and prioritization of the vaccine, this will become more and more important to obviously all the individuals on this call that are going to fall under this category and this classification. We opened up the phase 1B category last week. If you will, the reality kind of our situation is everyone who wants a vaccine will get it. The plan does not determine if somebody can get a vaccine or not. This is really just taking and opening up those categories with the supply that we already have and will have in the future. Until there is enough vaccine for everyone who wants one, we have to prioritize those that are, we have to prioritize the exceptionally limited supply we have. And again, I'm going to show you that dashboard to give you a kind of a realistic perspective on the numbers that we're working with today. And obviously, our first priority as a team and as a state is to save lives by protecting our highest risk citizens, because they're obviously at most vulnerable to developing COVID-19, but also having additional risk factors associated with mortality with the COVID-19 situation. So what we can do now, we are making our plans based on organizational needs. We are awaiting additional supply, and you're probably hearing a lot about that on the national news, about making more and more supply available. With the transition, the administration transition in the last week or so, we're learning more and more information on how that vaccine is potentially going to speed up, and that's good news. And then, of course, we have to adapt. We want to make organizations, many organizations have figured out how to operate and adapt. They need to keep doing this for a little bit longer with the situation we're living in. Missouri's plan is really broken down into these three areas, and I think we've done an exceptional job. Obviously, as I said earlier, our goal is to save lives, reduce hospitalizations, and keep us safe. And I see a lot of you are working from home and tuning in from home, and I think that's great. I'm also working remotely, as is most of our team. We second, preserving the essential functions of our society. We want to make sure that we're keeping everything in the state of Missouri operating to help our economy and support those day-to-day functions that we need to thrive and survive. And then, of course, accelerating the equitable economic recovery. The quicker we can get everyone vaccinated, the quicker we can return to kind of business as usual, and making sure that we're protecting everybody in the long run. I love this slide because I think it does the best job of really highlighting what phase 1A vis-a-vis phase 1B. And then as we talk about moving into phase 2 and phase 3 of administering the vaccine to a wider population, this does a great job. I'm a visual learner of laying this out for everyone. And so you can kind of see phase 1A, we're talking about healthcare workers, those on the front lines, those personnel and residents that fall into those categories. Phase 1B are those individuals that are higher risk and that are critical to our Missouri infrastructure, emergency services, public works, public health. Phase 1B, tier 2, and again, I know this is really confusing, are those high risk individuals. And then also in that phase 1B, tier 3 category, are those individuals that are really critical to our infrastructure and kind of our continuation of government. Here's a breakdown by population so you can have really a realistic sense of the number of people we're trying to get vaccinated and these different categories. So you can see, about 500,000 that fall under that phase 1A. Our emergency services is about 200,000 individuals that work across the critical infrastructure in our emergency services. This category are high risk individuals that fall under phase 1B, tier 2, are obviously significant. We're trying to vaccinate 2.5 million individuals that are eligible for this category. Obviously, that is a huge priority for the state. And then you can also see our critical infrastructure, our economic recovery, those individuals that are going to help us get back to some level of normalcy, and then those that are remained unvaccinated in phase 3. The total population of Missouri is about 6.1 million. So we have a lot of people that we need to get this vaccine to as quickly as possible. I talked a little bit about some of those employer-initiated models. I won't go into too much of the detail because you're going to want to know where a lot of these vaccine sites are going to be happening across the state. And Molly, I can't wait to share more and more information with you as that becomes available. We talked a little bit about, employer-initiated, where individuals can access the vaccine through their employer. I think the majority of individuals across the state are going to go to the vaccine if they are able to. Again, we're going to have a number of community events. These are happening across the state, and they're also happening across the country and having wide success. And so we will continue to promote these, and we ask that you help us promote those to the individuals that want this information. Eligibility screening. This is a question that we have received a lot over the last few weeks. So I wanted to make sure and cover this for you because a lot of people have questions. Am I eligible to receive the vaccine? So just to kind of go over this in a little bit more detail, anyone seeking a vaccination must provide a verification of their eligibility when their phase or their tier is activated. There'll be a screening form that will allow citizens to be vetted in their phase and in their tier. Their screening process will be the only requirement for verification. Our goal as the state and as the team is to make the burden of proof as easy as possible on the individual, so that way we can get people vaccinated as quickly as possible. Our ask of citizens is to do their part to indicate their own eligibility for the vaccine and attest that your selection is truthful. I had this question come up. I was presenting to the Missouri DD Council a few weeks ago, and somebody asked, what do I need to do? Or if I'm a caregiver of an individual with a disability, do I need to prove that they have a disability in order to get that vaccine? The question is, it's self certify. You go in and you basically say, I fall under this phase, this category, and you are eligible to receive that vaccine. We will have forms available on this very, very important website that should be your one-stop shop for any question, MissouriStopsCovid.com. Your vaccinator site will have that, and of course, it'll be integrated into the vaccinators electronic registration system. If you are signing up directly with a provider or a pharmacy, citizens will not need to complete a separate screening form on the state's website unless directed by your provider, your primary care physician, or that particular pharmacy. Essential employees. I don't know if this is applicable to anybody on today's call, but the plan will not distinguish between an essential and a non-essential personnel within an organization in a priority phase. Any employee at an organization within the priority phases listed below is eligible for a vaccine at that time, and if that phase or tier is activated. So again, not to make it confusing, but essentially, whatever category you fall under, that we have opened up across the state, you are eligible to get the vaccine if it's available. The last thing I'll kind of touch on, and Molly, I will send this information along to you in the slide deck, and I know you're recording today's discussion, so if folks have additional questions that won't be answered in our Q&A session, MissouriStopsCovid.com, and it has all of the facts and the resources. I can tell you it's updated a couple times throughout the day for the team that's working on our COVID-19 response. You can find out if you're eligible to receive the vaccine based on our state's phased approach. We also have a hotline. We have an email account that is consistently and constantly responded to from individuals. And then, of course, we are encouraging individuals, when your phase is activated, you can contact your healthcare provider or your pharmacy to learn about any additional requirements that they may require. And that may include their participation in community vaccination events. Again, a little bit more information for businesses. If you have questions about your employer, you can submit some of the inquiries related to volunteering your services. We're always looking for individuals to help us. If you have questions about moving into a different phase, we get that a lot. Do I meet these different requirements? Am I in this phase, or am I in this other phase? We're happy to help weigh in and give you some guidance there. Enroll. We're always looking for companies and additional sites to be part of our vaccinator database and to help us provide that on-site vaccination for employees and for companies. Last week, we launched our employer playbook to help support employers across the state of Missouri to participate in the vaccination effort. Again, Molly, this is another resource that I'm happy to share with you to kind of spread the word. And then, of course, making our community vaccination events, promoting those are getting put online every day. And so we want to make sure that people are aware of those events happening in their local communities, because this is a significant way we're going to move patients and move individuals to get the vaccine. The last thing I'll say before we open it up for questions, many people know that the vaccine, the supply that we have, is coming from two different companies, Pfizer and Moderna. And it is a vaccine that is required to have 2 doses. So you're going to have your initial dose, and a few weeks later, depending on the vaccine that you're receiving, you will find out all of this information when you set up your appointment and go to get your vaccine if you want one. And then you will have that booster, that second dose. And so it's really important that people have that dose on the day you're required to get it. And all of that information, once you make your appointment and go get your initial vaccine, will be made available to you by the individual or the provider that is administering that vaccine. So it's really important for folks to know that this is a 2-dose vaccine effort in order for it to be effective and helping prevent COVID exposure.